What is the consensus among the medical community about the severity of this particular coronavirus?
Well, I think most of us believe that this is a pretty significant concern. We don't yet know all the details about this virus. We don't yet know how many cases there are that are mild or asymptomatic, but it certainly is alarming.
Now, you are a senior scholar there at the Center for Health Security. When it comes to health security, what tools do agents have to combat what might be a large-scale breach, whether it be intended or unintended?
Well, the first thing to do is try and identify cases and isolate them to prevent further spread. And hopefully we can have countermeasures, that is drugs or vaccines, that can help control the disease. But so far for this virus, we don't have either of those.
No, now certain companies are trying to figure out a way to mesh drugs together and potentially come up with something to stop this. Is the medical community starting from scratch when you find a new coronavirus, or are there signifiers, are there, research that you can go to at least begin, not from zero?
Well, certainly we've known about coronaviruses for many, many years, and there have been attempts to make vaccines for other coronaviruses. So we do know a fair amount about it, and there are places that we can start. We're not starting from scratch entirely, but it will take considerable time to have a vaccine for this virus. We are hoping that maybe there are some existing medications that may be of benefit, but so far that hasn't been proven.
The fact that we're not seeing any new cases being reported in the United States, should that give us a lot of breathing room? Should we be a lot more calm because of that?
I don't think so. I think it's great that we haven't seen any further cases, confirmed cases in the U.S., but we've had 5 so far. We have over 100 people who are currently awaiting the results of their testing. So I do suspect that we will have some more confirmed cases. The most important thing is, so far we haven't seen any transmission within the U.S. These are all people who've come from Wuhan, China, and were infected there. If we start to see people becoming infected in the U.S. from other travelers, that'll be a reason for great concern.
How many coronaviruses are there, Dr. Toner? And given that we hadn't really been focused on anything like a coronavirus before, how many other types of viruses are out there that are a real threat?
Well, I would correct you. Certainly the 2 most well-known coronaviruses are the SARS virus and the MERS virus. The MERS virus continues to circulate in the Arabian Peninsula and causes occasional disease and death there. The SARS virus in 2003 caused 8,000 cases and 800 deaths. In addition, there are 4 or 5 human coronaviruses that cause essentially colds. Coronaviruses cause about 1/3 of the common cold.
Dr. Toner, thank you for all of your expertise. We hope to stay in touch. And once again, thank you. Dr. Toner is senior scholar at the Johns Hopkins Center for Health Security. The Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and of Bloomberg Philanthropies.